Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This parasitology lecture is about onchocerciasis. Onchocerciasis is a parasitic disease caused by Onchocerca volvulus. There are two clinical types of onchocerciasis. One, ocular onchocerciasis. This disease affects the eye, and it is also known as river blindness and your blindness. Two, cutaneous onchocerciasis, and this affects the skin. Distribution of the disease. The disease is found in equatorial Africa, Central and South America, South Sudan, both types, ocular and cutaneous. Northern Sudan, it is the cutaneous type in Abu Hamad area. The vector is a female black fly, scientifically known as Simulum damnosum. It breeds in fast running rivers and streams. Here is a narrative description of the life cycle. Infection is by the bite of the black fly, where it injects the infected larvae, L3 larvae, into the skin. The larvae go into the subcutaneous tissue, and there they mature into adults, males and females, in a matter of 1 year. The adult worms remain single or entangled, wound together, and live for 15 years. The worms entangle in nodules in the subcutaneous tissue of the skin, forming onchocercoma. The female worm is about 30 to 80 centimeters long, and the male is about 3 to 5 centimeters long. The males and females mate, and the females lay microfilary. Microfilary are larvae. So the worm does not lay eggs. It lays microfilary or larvae. The female lays about 1,000 to 3,000 microfilary per day, and this may continue for a duration of 9 years. This is a figurative demonstration of the life cycle. I'd like to mention here that the microfilary can live in the subcutaneous tissue from 1 to 2 years. Pathogenesis and pathology. The eye and skin lesions are immunologically mediated by dead microfilary and Wolbachia. Wolbachia are gram-negative bacteria found in the worms, and they help the worms in reproduction. In heavy infection, more than 100,000 microfilary die per day. In the eye, the immunological reaction will lead to corneal opacity and affection of other parts of the eye, leading to blindness. And this is the result of the blindness. Also, there may be itchy skin rash and the continuous and prolonged scratching will lead to such disfigurement and the skin loses its elasticity. The entangled adult worms, they form onchocercoma. Here you see the arrow is pointing to onchocercoma. Diagnosis: clinical, by clinical assessment, taking history and physical examination. Then to confirm the clinical diagnosis by laboratory investigation. The laboratory investigation is after microfilary. So the specimen to be collected is a skin snip, and this is a way of taking a skin snip. Then you put the snip in a moist petri dish, moist with normal saline, and you wait for 20 to 30 minutes, and then you put the snip in a glass slide, and you look under the microscope looking for microfilary. The microfilaria of Onchocerca volvulus is unsheathed. It has no sheath, and the nuclei do not reach the tip of the tail. Once again here, the microfilaria lives for 1 to 2 years. Treatment by the drugs ivermectin and diethylcarbamazine. Prevention by treatment of patients and vector control. I hope that the lecture is understandable and I wish you all the best.